Can everybody make sure they're on mute before we get started, please? All right, in the interest of time, I'm going to go by the agenda, give a quick introduction, and then recap from last meetings, give a couple of updates, and then we're going to talk briefly about something that's new, our state liaisons to your subcommittees, and then we'll hear from those subcommittees and then open it up for the advisory board to ask any questions or speak about any new things that we have going on. So first, good morning to everyone. I know it's been a while since we met last, but all of the subcommittees had a chance to meet. So hopefully you had a good time to speak with your other advisory board members, specifically about things that we think that you're most interested in and your expertise could be used in helping us guide our strategic plan and the work ahead. So a couple of things that I want to touch on that between last meeting and this meeting is we have a new deputy director that most of you hopefully have already met, Ms. Ciara Scott, who comes to us with an amazing health background and came from UNC. Very, very excited to have her on board. And again, most of you have already spoken with her, but if you have not, you definitely will today. The next thing that I really want to speak about is I didn't have a chance to speak about it before, and so I want to make sure I talk about it now. All of the subcommittees were started based on the questionnaire that we did the first meeting, but also just a lot of the input and information I got when I first started doing the landscape analysis around the state. And a couple of key things stood out that continue to stand out. And when I give my next update, you'll understand why I want to be so forward about it. And this one, and asking for your help and advice. One key observation that I continue to find is around the training, professionalization of CVI and data sharing. And so we're going to speak about that a little bit more after you do your subcommittee readouts, because hopefully you covered a little bit of those. But one of the key things that I want people to think about from the very beginning of this advisory board meeting is a key takeaway I continue to find is we know a lot of times who the high-risk individuals groups are and what many of their needs are, but there doesn't seem to be around how to get direct services to those individuals. And I know we put this in the subcommittee, but if we can make sure at the end of this, if you have any questions, any advice, I think we need that sooner than later. We have a lot of time to, of course, work on it and give feedback. But that's something that I think if you have best practice or you know somebody that's doing it well right now, at the end of this meeting, please let us know because that's something that we want to share immediately. So that's kind of the things that's on the top of my mind. Refresh from the last meeting that we did in person. Again, we talked a lot about what actionable things can be done. There have been some notable events between that last meeting and this one, particularly around violent crime. And so speed is of the essence in this. And so I will pause there. And Ciara, is it anybody new this meeting that was not at last meeting that we need to do introductions for?
Well, Gerard, I wasn't at the last meeting, so
You're gonna get your own time. Yeah, not you. So okay. Okay.
There are
So the
some
next,
names up here that I don't think I've met.
okay. So I want to make sure we pause right now. If this is the first time, for instance, I know Miss Sullivan, this is the first time that you're here. We're going to get to you and the liaisons at that portion of the agenda. So I want to make sure we that I acknowledge that you are here. But we want to give you a brief time for intros when we get to that section. The last update is effective May the 10th. I will be officially stepping down from this role and miss point of contact for all things OVP. Some more questions about that towards the end. If anybody have any concerns or worries, but for personal reasons, I'll be stepping down on May the 10th officially. So I think that is all we have for new business now. Let's speak about the strategic plans. Now, moving on to state liaisons. So when we first developed the subcommittees, we started to find that a lot of the subcommittee members had specific questions related to state programs, data, and information that can be best provided by individuals who are currently working in government. And so along that vein, we have identified amazing in-state government that will serve as liaisons to answer those specific questions or concerns that you may have related to state information, programs, services, points of contact that can best get you the information that you need. And so I want to briefly allow them to give an introduction for themselves. So for our information and data sharing subcommittee, Scott, can you give a brief introduction of yourself, please? I'm sure many people know you, but you could do a quick intro. I know you have to run.
Yeah, no, I appreciate that. Thanks, Gerard. So I'm Scott Preschel-Bell. I'm a state injury epidemiologist and have been working with the Injury and Violence Prevention Branch for about a dozen years. And my shop kind of oversees a lot of different data for a large profile of injury and violence. But we have information on the fatalities and non-fatalities related to injury and violence. And so we have been working with Gerard and others, many of you over the past few years around some of these topics, and we're happy to kind of help facilitate, and generate and share the data that we create and that we're a part of. We also can do sometimes custom data requests, although we need a little bit more lead time on that, but we have a website that has a lot of the data that's been posted. We have a dashboard that is hopefully useful. We're happy to put it in the chat, and I'm happy to provide kind of an overview of the data assets that we have in our state at some point. So thanks, Gerard.
No, thanks very, very much, Scott. As new counties and cities ask for data, Scott often is the person that I go to in one instance who told me the county has all of the data that they need, and here are the in the county to get you that GSW related data, as well as managing faster and many of the other things that I'm sure the data sharing group will speak to you about where you can find specific data in our next meeting. So our service high risk service delivery, our Deputy Secretary Caroline Valland, most of you already know her for sure. She's at all of the meetings. But Caroline, if you could give a brief intro for those who may not know you.
Hey everyone, I'm Caroline Valland. I'm the Deputy Secretary for Partnership Engagement at DPS, which oversees several external facing boards and commissions within DPS and some high priority projects like this one for the Secretary. So glad to support the group in any way possible, answer questions, try to point people in the right directions. I feel like oftentimes I don't know the answer, but I know how to find the answer. So I'm glad to support y'all in that manner.
Absolutely. And all of the questions I've had since I've arrived related to state government and a who's who of finding information, Caroline knows. I'm sure she'll be amazing for that subcommittee. CVI professionalization, training, certification. Zeev, I believe Zeev is here. Zeev, are you here?
I am here. Good morning, everyone. I'm Zeev Dalsham-Kahane. I'm policy advisor for Governor Cooper covering criminal justice and public safety.
And so Zeev's at the governor's office. So again, who's who of where to find information and who knows who. And if you have any specific requests around who in state government does what, he will definitely be able to help do that, as well as I know he's very passionate about ensuring we have professional development and training for our prevention workforce. Youth violence relevant are you? Yep, you are right there. Can you give a intro? And I think your title will fully explain why you're the liaison.
Sure. Good morning, everyone. Nicole Sullivan. I'm Director of Reentry Services for Juvenile Justice and Delinquency Prevention within DPS. And so I've had the opportunity to talk with Dr. Tate on numerous occasions. We've been at some reentry simulations and having lots of conversations about ways that we can better connect individuals to resources in their communities to promote public safety. So I'm fairly new to the youth space. I've primarily been on the adult side, but there's a lot of work to do on this side as well. And I look forward to working with y'all on that.
Absolutely. And that expertise from the adult side and reentry will definitely be called upon as well. As again, as I opened it, we often know who many of the individuals are. They are not, they're system, but how do we get services and supports to them is some of our top priorities. Linda, sure. Ciara, did I cover everything related to that section already? Anything that you want to add there?
Nope, you covered it.
Okay. So now we're going to move on to our updates from the subcommittees. Because at the end of this, I would love to get feedback and questions or concerns that advisory board members have. So,
Gerard, it broke up just a little bit. Could you repeat that?
yep, absolutely. We're going to move to the updates from the subcommittees. Can you hear me more clearly now? Doing this from kind of really far away. Yeah, let's just move on to that just in case it breaks up again. So, Ciara, I want to transition it over to you.
Okay, thanks. So like Gerard said, we'd like to get some updates from each subcommittee. We'd like to hear about how your initial meetings have been going and, you know, what questions have come up as you're thinking about how your group will get to your recommendations that have been requested from your subcommittee. And so we're going to just ask each chair to just kind of report out, give that update about how your initial meetings have gone, and then also pose any questions to the group. And so just keeping in mind that not only do you have access to our office right now in this meeting, but also our entire advisory board, which, as you all know, is a well thoughtful, put together, multidiscipline advisory board. And everybody's on here for a reason. And a lot of people in this group sit in a lot of different spaces around the state, have access to different resources. And so we want you all to pose whatever questions have come up, because it's very likely that somebody in this group is going to be able to help get that answer for you or get that information to you.
Ciara, one thing that I forgot. Can you give
Yes.
an introduction of yourself first, please?
Sure. I mean, I feel like you covered it mostly. I'm Ciara Scott. I'm coming here from the UNC Injury Prevention Research Center, where I've been working for the past few years. And my background is in public health, and I've been working in the space of injury and violence prevention for the past 5 or so years. And a lot of that work has been in some violence prevention topics, but more so in the root causes. So working on some ACEs prevention projects. I also had the pleasure of working on a lot of projects very closely with the injury and violence prevention branch. So I worked closely with Scott on the Foster project and some other ones with the branch, and hi Glorina. So yeah, so that's a little bit about me.
Yep, and why I think that's vitally important is we're really strong on kind of the court services, law enforcement side. If we're going to take a public health approach, we have to bring public health professionals and public health best practices that we have used in other areas around injury and violence prevention into the space of gun violence. And so CRO will absolutely be leading. And yes, continue. I just wanted to make sure I added that.
Thanks, Gerard. All right, so I'm gonna ask Dr. Banks if you could go first with giving updates for the information and data sharing subcommittee.
Sure. Good morning, everyone. Hope everyone's doing well. Our first meeting, I think, went well. I had a lot of energy. We discussed a few different points. So there's definitely a need for comprehensive data um, collection and services across the board. One major point that was discussed was usually the trauma registry only includes individuals that make it to hospitals. And then obviously there's individuals who don't, either by choice or even by death. And so it would be great to have some kind of data system that captures a more holistic picture. And then this data could be used to allocate resources to communities. And it could help law enforcement do more targeted outreach as well. And so naturally, we'll have healthcare providers, or we want healthcare providers and law enforcement partners, as well as maybe universities partnering with this. There were some concerns with how the university should be involved. So we discussed maybe having some parameters like only local universities should deal in their local area. If research is going to be a part of the collaboration, then it should be built into a data use agreement. And then there has to be effort towards actually providing solutions to communities and not just conducting research. So for the data that seems to be the most important is the location of penetrating trauma, as well as demographic data. There was an explicit call out for the need for rural data as well, and then any existing community resources. Let's see, we need prevention and intervention data points, the highest risk individuals data, as well as access to juvenile justice data, shot spotter data if it's available, and then any public county data as well. And then there's some interesting software that could track risk scores for communities that was discussed. So it's a GIS program. So that could be a possible tool, or maybe the state already has it. I'm not sure yet. But then we'd also like to collect social and economic data, school performance data, infrastructure, like jobs, transportation in particular communities, grocery stores. Then there was also discussion of some barriers to sharing the data. So there could be some resistance to law enforcement due to potential over-policing or maybe even misuse of data in history, or then there's the HIPAA laws, hospital policy, organizational policy. So we'll probably need some help navigating through all of those different barriers to make something cohesive that everyone can use. Let's see. And then some other potential points for outcomes. So as we're thinking about how this whole structure should look, but definitely want to capture penetrating trauma outcomes. And then we talked about this idea of what a thriving community would look like. So we would have to put some definitions around that, and that would drive some of the data points. And then behavioral issues, employment, education, reduction in gun violence, and then reduction in youth gun violence specifically. And so then we talked about some of the ways this could be shared. And so we were thinking about a dashboard. There are a couple of models that are already in use that could be good to pattern after. So the University of Chicago has a violence reduction dashboard, and the University of Louisville also has one. And then naturally, we want this data to be aggregated and de-identified. And then we also talked about how possibly, even though we're probably going to be quantitatively focused, but it might be valuable to also collect some qualitative data and have possibly even some success stories down the line. And then right now we are looking into the research and trying to, in the literature, to try to find out best practices for data sharing, and also some other models.
CR, if I could add just one thing, Dr. Banks, I want to make sure, I know you're going to meet with Scott, but definitely meet with Michelle Beck as well. I'll make
Okay.
sure we add that to the list from Justice. My brain is everywhere. Director Beck runs a Criminal Justice Data Analysis Center, but between her and Scott, I think all of the data spoke about, some of them may be in commerce and workforce development, some may be in, of course, education. But between those two, they'll be able to let you know where the data lies and who can be those POCs for it. So I think Scott will be super helpful. So I just want to make sure you connect with him and Michelle. CRO, apologize. Just want to make sure put that
No,
on his
you're
radar.
fine. That's what we're here for. So thank you for sharing those updates, Dr. Banks. And I guess I do want to give a chance, one, if there's any specific questions you'd like to put out there to the group in this moment, or if anybody has any questions or feedback from those updates that Dr. Banks just gave. So let me pause and see if anybody has any questions or feedback first. Okay.
The committee did have one question. What are your thoughts, or what is the overall project timeline for this subcommittee, and then overall, as far as how soon do we want this data up and running? And
So I think the recommendations for what is needed and how we may want to do it will be towards the end of June, just the recommendations. What you talked about is a lot of operational things that need to be put in place, and that, no, for sure, that is long-term goal for sure. But we at least what your recommendations are and saying, here's the data we need, here's how it may be analyzed, here are some options that we can utilize for the dashboards or other analysis, and working with the state liaisons, those recommendations towards the end of June. And then from that, the recommendation that we then adopt because they're feasible, in the short, medium, and long term, we'll make plans related to that at that point. But recommendations at least by the end of June.
thank you.
Okay. I think you said that was your only question, right, Dr. Banks? Your group's only question?
Yes, thank you.
Okay, thank you. All right. So if there are no other questions for the Information and Data Sharing Subcommittee, then we're gonna move forward. So I'm gonna ask Azuri if you could share updates for the Service Delivery to High-Risk Youth Subcommittee.
Yes, good morning. So we were able to meet, and we spoke about a variety of things. We went over some resources that are available now. I'll say that the caveat to this was that most of the people on the call were from Durham, so we were speaking about services in Durham or what we know is available to this category or this group of the population that we're talking about serving. We discussed some resources that may be necessary in this realm. Having mentoring as a piece of the puzzle is something that we discussed, a huge part that may be able to support delivering services to the highest risk population, and what and what issues they may have. Also the barriers, messaging, right? We discussed how messaging isn't reaching the intended audience. Where have we seen that the messaging working or not working? The fact that we have NC Care 360, but it doesn't have all the resources available to the population. Not all organizations are using it, and the need for a general database of all services throughout the state because of many of the programs touching different people elsewhere. Like for instance, the hospital, we're getting people from different counties, knowing where to refer them to and what organizations are doing the work. learning how to dip in and dip out, talking about, where that lies in working with people, not holding on too long, but also not leaving too quickly, some longer term resources. And then again, like I said, identifying programs that are working and learning from the research of CVIs and HVIPs that have been around for a while, and what they have learned in the process of their work. So that's pretty much the update that we have.
Okay, great. Thank you for sharing that update, Azuri. And does your
I'll go ahead. I'm sorry.
go ahead, Gerard.
Before we get to that subcommittee question, did you all talk a little bit about what are some of the reasons why the messaging may not be reaching that highest risk population, or do you have any insights on why you think that may be, or when we open it up to the other subcommittee, the other advisory board members or liaisons, if you have had any success that you can help them out with?
I think it would be good to have that feedback because we just talked about it uh, in a sense of what we know as far as in Durham, but we can't really say elsewhere. And I think Crystal has her hand up because she may want to add to it.
Good morning, everyone. I just want to add, I think we kind of discussed this area, if I'm remembering correctly. Some of the messaging is that there's a lot of resources, but there's no one place for families or high-risk individuals to locate the resources. It's kind of like a lot of things are by word of mouth, or if particular individuals know of something, they may share it with the person, but there's no collective like database or statewide database. And I think that's how we started talking about NC 360. And if that's actually being utilized the way that it was intended to initially, who actually has access to that. But I think that's the biggest part of the messaging, is just really getting it to being in one centralized place that everybody has access to.
Yes, that was it. Thank you so much, Crystal, for adding that.
Super helpful. Thank you. That's all I had, Tina.
Okay, and I guess first, before I ask Azuri about specific questions, does anybody else in the group have questions or thoughts they want to ask or share with this subcommittee?
Actually, I'm sorry, I did not raise my hand. There's enough squares that I should, but I didn't. I was shaking my head vigorously about the NT Care 360 because that's a very active conversation over here with JJ. And I'm sure also in adult correction. And so, and then I'll tell you, I recently got pinged by another group who seems to be doing yet a similar database. That involves some other consultants. So it does seem like there's competing databases out there to be that resource connector. And we all know this is the huge part of it. There are services and there are people in need of services, and connecting them at this basic fundamental level continues to be a huge problem within these systems, all systems. And then you want to be able to track what you're doing, and you want to make sure that the folks you're referring to are doing good business and are responsive. And then there are people in like our agency, we need feedback, right? We need to know what happened, when it happened, those type of things. And so I think this is a huge kind of underpinning, kind of foundational piece of a lot of this work, is we have got to figure out how we try to kind of take the this is my database and this is my application and this is the one we use, and just kind of say, if you're in this work, you're trying to connect people to the services they need in their community without it having to go through so many people to get people connected. And so I don't know the answer. I don't know that NC Care 360 is the answer, but I know that there's been a huge investment in it. But there clearly are other folks trying to step into that space, and people are doing things on a county level and maybe regionally or through just different systems. And fundamentally, I hope that maybe this group can try to say, you know what, at some point we just got to say, this is what we're going to stick with and we're going to build off of it. And we really need everybody committing to being on a platform so that we can help folks. I mean, you know, we work with youth. They don't always have the agency, but that means I'm talking to mom and dad. got to connect them, try to get them, back, connected to the services they need so they can support this young person who we're handing back to them. So it's a huge issue for us and ongoing conversation. And so I don't know where we are in the priorities. I'm sorry, this is my first meeting, but I really want to see us do something about this issue because there's too many folks even coming to little old JJ saying, hey, be on this platform, do this, do that. And we need to get connected in some intentional way about services and how to get people who need services connected across the state.
So much. This is the right time for that. So thank you. It is the priority list. That's kind of why I opened it in the beginning. We know who they are. How do we get them the services? And so we very much look forward to not only your help, but also in helping to develop those recommendations that we can then send forward. Because I think I attended a meeting at JJ about another platform with an app and all of these other things as well when you bring it up, and we do need to get on board for that. And it is my hope that some of the community health workers and violence interrupters and other outreach folks who are supposed to be tasked with having that direct engagement, mentorship, and support can be first trained on it, and then giving us some feedback related to that, which I know we'll talk about a little bit with professionalization. So thank you very much for that, Ciara.
Tracy, I see you have your hand up.
I just wanted to circle back around to, good morning. Wanted to circle back around to the conversation specifically about messaging and intended messaging actually reaching those young people. And I think there's a need to make sure that we have platforms, that we're putting messages in platforms where young people who are at risk, high risk, opportunity youth are actually going to see those messages. And so a lot of times we're putting things on web pages and no one is going to a web page. Let's be very honest. I don't know your own agency. When was the last time you went to your web page unless you were specifically looking for something? Young people are not going to those locations. And so when we're putting things in places where they're not going to see it, it defeats all of the purposes. Not only that, I think we have to make sure that we're intentional about those persons who are developing those messages, making sure that they are culturally appropriate, that they are relevant and timely for those individuals that are looking for them. If it's not spoken in the language in which they are able to receive it, it defeats the purpose. And so a lot of times we are choosing vendors or selecting vendors that aren't at the best to meet the needs of the folks that we're serving. So thinking about how we cut through some of the red tape to put messages in platforms where young people are going to see them. I know for myself working at the county level, we have a lot of issues with like, can you use TikTok or can you use some of the platforms where we know people are actually receiving messages? So I think there's a need to press to be able to put messages in places where that's going to be more intentional for those young people to see them.
Tracy, thank you for that. I almost start snapping my fingers like you do at the spoken word things, right? But I was feeling that that sounds like it definitely needs to be a recommendation that may give some motivation or some extra assistance for those decision makers to let us at least do some trial periods related to social media. Because you're absolutely right. When you brought up going to websites, like I literally Google search things on Instagram and TikTok even now at almost 40. So I know the kids aren't looking at it. That's the first time I actually heard that point in my travels. And so I wrote that down and put some stars next to it. Is there anybody whose agency, city or county is using social media in this way for any of you? Yes, I'm pretty sure. I think they are for something because I've seen some things at least on LinkedIn or something. But if you are, to people speak about it, please.
I'll jump back in right quick. We have used social media, but we don't use it through the county. So we have another organization that we've convened that is purposely not a county group. It is a community-led, community-based organization group, so a coalition. And because that coalition is not directly linked to the county, and we purposely did not link it there, we say we are the conveners of that group, but we don't hold that group and the power within that group. It lies with community. We're able to use their platforms through social media to put messages in places that the county would not allow us to put them. And so we just kind of had to find a back door.
Well, that sounds like an amazing strategy that I'm sure other people will be very happy to hear as possible. A really strong community-based organization partnerships. Um, okay, Ciara, I'm going to be quiet now. I think there's one other hand. Will, was your hand up related to that question? Or
Yeah, I was just gonna
Director
say,
O'Neill?
here in Buncombe County that we utilize Facebook, but we had two interns that created a page that was more appealing to youth, that we're using to put some information out, especially evolving around youth justice.
No, that's great. And using interns that are of that age and that generation and just providing the oversight, I think is a really good strategy as well. Thank you all for sharing.
I see we also had some feedback in the chat, so Azuri and the rest of the subcommittee, just make sure that y'all also check the chat. There were some comments in there. Okay. Any other thoughts, questions, feedback for this subcommittee before we keep going? This is the high risk delivery or service delivery to high risk youth subcommittee. All right.
Wait, I have one question. Is anybody doing this well? Does anybody have an organization, a county, a city that is doing it well?
Define well.
It's having some success reaching those that we know is the absolute highest risk, and we have some data, or at least some preliminary qualitative feel good about them actually moving through services and supports to stabilization and lower risk levels. Zori?
Is anyone here from Mecklenburg and that's familiar with their Office of Violence Prevention?
Oh yeah, the director.
Yeah.
Yeah.
I'll say we don't have any qualitative data that really talks about how well we've been able to engage that population with the messaging that we've done, but the qualitative feedback that we received, even things from the development of t-shirts that have messages on them. The company that we use, the vendor to develop those t-shirts, they actually chose the colors and selected everything based on the new J's that were going to drop soon. And so literally we would have people be like, I got some shoes to match this shirt. And people that we didn't think would be able to want to put those shirts on with those messages on them are rocking those shirts everywhere that we see them. And so we were really excited about that. So we know that we were going down the right path in terms of getting folks to see those messages and just making sure that we're very intentional about where we're placing those messages. So places where we put a lot of things in high traffic, foot traffic areas. We've done clean graffiti where people have to actually step over messages, or where places we know what we see a lot of people hanging out and just standing around, like in front of gas stations or little convenience stores. We put messages in those places, at bus stops, on the light rail. Lots of places where we know people are going to see those messages all the time. We have radio ads that we put on major radio stations, so we know people were hearing those because they listen to No Limit Larry, and he actually is one of our outreach workers for our ATV program. So just being very intentional about focusing on young people and the messaging, and making sure that the messaging translates with them. So we've used interns before to help us get those messages out or test those messages. We've got a youth advisory council that we run things by to see what their thoughts are about the messaging before it goes out. So just kind of doing those test runs with folks. So we, again, don't have a lot of quantitative data that I can provide to you, but the qualitative feedback that we've received on some of the messaging that we've done has been very, very promising. So we're excited about what we're doing and going to duplicate a lot of those things in an upcoming communications campaign.
That is amazing. The J's and the t-shirt was, again, I'm writing down these things. We know that they're going to go buy those specific shoes, and those shoes will be overrepresented in the neighborhoods where we're going to see a lot of the gun violence. And so that is a very, very strategic insight. That's amazing. Okay. There is one person. Okay, we can move on. Ciara, I'm gonna send it in a message.
Okay. And I saw Azuri had her hand up, so I do want to give you a chance. But Tracy, there is a question in the chat for you from Sheriff Burkhead, so just want to call attention to that. But Azuri.
Yeah, so I think it's helpful too as well is to have a variety um, of I guess presence in the group because there's some areas we're not going to know, right? The most of the people who were in the group were from Durham, so we can only speak to what's happening in Durham, right? We can do research other places, but to have people who are knowing what's going on other places would be helpful. The other thing is that we did talk about messaging that public health was doing around testing and vaccinations and how that's been working for them as a frame of reference. But I like all of the feedback that was given. And so we're going to take that back and discuss that as well. So thank you all for that.
Yep, and Azura, just so I'm clear, is your subcommittee, are you saying it's too heavily populated with Durham folks, or just in the meeting, it was the
In the
people?
meeting, that's who showed up.
Okay, gotcha. Okay, I just wanted to make sure. Okay, thank you.
Yeah, that's helpful feedback, Azuri, and we'll talk with you afterwards and just try to make sure that, yeah, with the other group members, there is representation or see what we can do. But also want to point out that is one of the utilizations of these meetings is to have access to the rest of the group. So that conversation that just happened was a great example of how we want to be able to use this time. All right, well, thank y'all. So we're going to move forward to the CVI professionalization subcommittee. So Will, could you please share?
So yeah, we in our first meeting, I was very excited with that meeting. A lot of energy, a lot of willingness to understand the models of violence prevention methods that we're using around the state, and how to better utilize best practices from those models, to professionalize this training, as well as to make sure that there's a standard set across the state for what a community health workers training should look like. We do have another meeting scheduled for next week that I'm very excited for us to meet, to even dig into this even deeper, with Miss Sue and Patricia were present at that meeting. We just understand with the subcommittee that we have to give our communities better than what we're given across the state. And I do believe with the information that we're sharing back and forth, and as we reach out to other organizations across the state to figure out what practices they are using, what violence prevention methods they're using, that we will be able to come with a really good recommendation for community health workers across the state of North Carolina that I do believe will span even further in North Carolina at the completion of this.
And well, if I could ask a question about that, because I will tell you a common issue, problem, data sharing, relationship building that I had even before I arrived in this role, but since I've been in this role, is the different models that are being used by the prevention workforce. Some of the different titles, the different names, the different program fidelity, whether it's Cure Violence, whether it's CHASM. In those recommendations, in those discussions, do we speak anything about, for instance, when I look at the community health worker CHASM model, it is much more prevention than intervention. And I see a lot of the Cure Violence is a lot of intervention when implemented with fidelity. And so are you all going to make sure that you speak about kind of the prevention and intervention piece and what training and support, or is it way we'll try to merge the two? Just speak a little bit about that.
I do think that they're going to be best practices from both. But the key word that you use is doing it with fidelity. So we don't want to try to take something and add something from prevention to intervention that's not going to work, especially without giving the proper training. So maybe the recommendation would be, if you're in intervention, to take a preventative training that would lead to you're not even having to worry about the intervention because you're doing more the prevention side to kind of strengthen what you're already doing. And I think that's what the chasm model that you spoke about does, is it adds that piece to it. So I think just really trying to figure out as a committee what some of the best practices are from the intervention side, as well as prevention side, and moving forward with a recommendation.
Yep, absolutely. And Tracy, we spoke to somebody from Mecklenburg. Her name is skipping me now. She runs you all's community health worker type program there. I bring that up because I see different things when I go to cities. I see some that are very prevention focused, and I see some that are very intervention focused, more secondary prevention, secondary prevention focused. But we're asking the individuals who are trained to do intervention to move more upstream to do prevention without providing them the training and support to be able to do that, right? And so if we identify them and we asking them to speak about connecting people to resources and services and supports, and I don't want to say case management, but at least doing some goal setting at the beginning to get them to reach those services and supports. Are we providing them the training and support that they need to accomplish the activities that we're asking them to do, right? And many times when I go visit some of the sites and I speak about when you go engage and do these things, they are very, very strong in intervention, less on the prevention side. And I think that is a gap, as well as when I look at the chasm model that is very, very focused on prevention, right, and not a lot in intervention. So when intervention happens, do we want to put them in that same position, right, when the roles are reversed? Or do we need to find something that fills the gap between the two? The prevention workforce in general in gun violence and CVI is still new. When I started working in DC in 2017, CVI wasn't even the word, right? There was not even funding for it. And when people started in weed and seed in the 80s and 90s, it had a different tone. And so I think I know from speaking to the federal partners and the CVI PI, what did they just have? They had a convening in Chicago a couple of weeks ago that this is a question that a lot of people are asking. And some of our federal partners are very much dependent on us at a state level to come up with some best practices for what this looks like. So I'm curious, especially from some of our law enforcement leaders, what would you like to see from the CVI prevention and intervention workforce and staff that may allow you to share more information or even better depend on them? Whether it's law enforcement, it's courts, juvenile justice, adult corrections. What do you want to see from those prevention professionals? Again, those community health workers focused on violence prevention and violence interrupters that may allow us to give better support them in doing this work. Nobody?
And look, I'm going to jump back in. That wasn't a question for me, but I'll say that I think in my opinion, you cannot do one without the other. And so thinking about people staying in kind of one lane, that it doesn't happen. Now, if you're on prevention side, we're not asking you to do intervention. Let me be very clear about that. You got to sign up to do that, because that's not something that everybody has the training or the expertise to do. But if you're doing intervention, you have to be doing prevention. And so thinking about how we help people focus on some of those things that are more upstream. We can't just work with the people that are in the thick of the issue and stay in that that secondary prevention or intervention space. That doesn't work, because that doesn't keep the people that are coming behind them from getting involved in the same thing. So we're not stopping the cycle of recidivism in this space. So I think it's important that it's a prong issue when we got to take a multi-prong approach. And so people need to be willing to look outside of the space that they're in to do prevention in various stages. And I think that's important. One of the things that we've been doing recently, or that we have done in Mecklenburg, is to, and the person you were speaking of was Keela Marlin, who is in charge of our community health worker initiative in Mecklenburg. But we've been partnering with them because we've been trying to really get community health workers in this space more so. We don't have them particularly working in violence prevention in Mecklenburg, but we know that from CASM model and other places across the country that they have been effective. So we have provided an opportunity for community members that we've identified to pay for them to go through the community health worker certification course that starts in May for Mecklenburg. We specifically were looking for people that don't necessarily do what we think is prevention or violence intervention, but they work in spaces or they're in community and people are always asking them for assistance. Prime example, we had a lady that works for the public health department that does environmental services for us. So she cleans the offices, but because she works in the public health department and in her community, people are always coming to her asking her about resources just because she works in the building. Not that she knows all the resources, but people are coming to her, and that's the type of person you want to be a community health worker, because those are people are already depending on them. And when we teach them how to use these services, when we teach them and give them access to things like NC Care 360, they're able to utilize those in ways that we don't have people that can. So we're just really trying to see more people in this space as we can to provide the services and get directly to the people that need them the most. I'll be quiet.
Absolutely. No, absolutely. You dropping gems, and this is particularly important both in our urban and rural environments. Our rural environments, and ensuring we have community health workers that are able to provide that education, knowledge, connection, and resources is equally important, as well as in some of our areas where we have a strong violence interrupter program, but we don't have a strong primary prevention, kind of more upstream and macro level prevention community health workers that are focused in this space, but that work at county health departments and other community-based organizations in the same city or county where we have violence interrupters operating, but they are not working together yet. And we're trying to work on that. And I'm very happy you were able to get some funding to get them to go for it without them having to pay for it themselves, which is typically a really big barrier. Director McNeil, I think you had a question.
Yes, I do. Related to what Tracy was talking about with the community health workers. One of the things that we're trying to do is get the community health worker certifications for our outreach workers who are part of our community-based organizations that are doing violence interruption as a pathway for them to further their employment. But my question is, I was sitting on one of the community healthcare worker calls, and they were talking about Medicaid expansion. And my question is, I know some other states are now including their violence interrupters in with their Medicaid expansion. I'm wondering where we are with that as a state, and also if we are trying to professionalize the work, would creating opportunities or pathways for community healthcare workers for our folks doing violence interruption and outreach to get those certifications, would that be something that we could potentially try to advocate for as this particular body?
So I saw Dr. Tilson on the call. I think she may have left, which means I'm going to have to answer this question. Dr. Tilson, are you here, or did she leave already? Sorry. I'm going to answer it briefly, and I'm going to say we are doing some work. DHHS specifically is doing some work. We did do Medicaid expansion here. There are some pilot areas where violence interrupter intervention type services can receive, in certain circumstances, reimbursement and payment for it in our healthy opportunities area. But if you email myself and or Ciara will get you in touch specifically in DHHS with the folks who are doing it. Right now, Greensboro is not one of the pilot areas. Medicaid expansion across the state, but from a violence interrupter standpoint and healthy opportunities and it's a waiver program that's doing it right now. It's only in 2 specific areas, I think across about 10 counties, but we can give you much more information about it. We are doing that work and they are seeking to do it across the state. We're just not at that level yet, but they are requesting that statewide expansion.
Yeah, just to expand a little bit on what Gerard was saying, there's 3 healthy opportunity pilot areas. Will could probably talk about a little bit because he's got one out in the Buncombe County area in the western part of the state. There's one in the northeast surrounding New Hanover County, and then, southeast, and then one in the northeast as well. But they have worked to expand and have applied to be able to take this statewide so that we can do better reimbursement. But we don't know yet where we are on that.
Health workers, we have Medicaid expansion across the state. Many of particularly the highest risk young men that we're talking about, particularly over 18, many of them now qualify for health coverage that they didn't before. It is a protective factor, a known one, that is showing that they have access to not only health care, but medication if needed can help to stabilize them. So this should be something that we all are looking into as we do our outreach and engagement with the highest risk, particularly young adults over 18. Usually the juveniles are already covered, but that 18 to kind of 35-year-old range, part of being high risk and kind of being in the street is typically not going to the doctor regularly, not going to the dentist, eyesight, having medication. Many of them qualify. Most of them qualify now. And I think it could be a good branch, non-traditional outreach and engagement strategy. And Rashad, I'm happy that you were able to hop on now. I was trying to get you added, but please hop in.
Yeah. Okay.
Did you have anything that you wanted to add? I'm sorry, I didn't know.
No. At this time, some stuff y'all was talking about earlier. You know, I was going
to circle back to it. Then, do you remember what you wanted to say?
And well, not actually, but I know one thing that I did hear about the best practices for prevention and intervention. So running the CVG model, we realized that it was a lot intervention based. So we came up with the idea of moving more towards prevention. So we do a lot of like we call it often alternatives to their idle time. So we offer education and employment. So that's one of the big things that we do working here in Wilmington, North Carolina.
No, thank you for that. And it's one in the subcommittee that I want you all to talk about even more, how you're able to do it. Particularly our young people have way too much idle time between the time they get out of school and the time they go to sleep. And if we can identify who they are, and help fill some of the idle time with pro-social activities, support, mentorship, all these other services that we're talking about. But the summer's coming around soon. So the quicker we can identify them and get them enrolled in programs and services and prioritized enrollment in programs and services, and working with Director Sullivan and asking whatever we can give. Juvenile data is a bit tricky, so we're going to have to work around that. But where we can, we want to make sure, and Rashad, you are in one of the pilot areas for healthy opportunities that we were talking about. So some of those services can even be reimbursed. So we should have that discussion to connect you with DHHS sooner than later.
And the biggest thing that we have been doing with the YMCA, the boys clubs around here, the people that are on our caseloads, they're required to sign up for one of those programs. So and that way we can have constant check-in on them. Our workers that's located in the school, they actually have to do a check-in weekly with the kids during the summertime, and we use those programs to do our check-ins.
See, we need that. So that as a best practice in how you're structuring it and what it looks like. And let us also make sure you put on your radar to reach out to us about connecting you with DHS still, because I think some of the transportation related to that, particularly for the adults and other things, may be something that Healthy Opportunities may be able to help with. So let's make sure we talk Will for you too as you look at that, so we can get some best practice. So if we do get it approved across the state, we already have some strategies in place that we can scale across. Ciara, where are we on the agenda? I'm sorry.
We do need to move to the next subcommittee soon, but I know Will has his hand up, so I want to let Will finish out.
So I'll be very quick. One best practice I do want to share with everybody while it's on my heart. I heard someone else saying something about they were going to have community health workers getting trained. Right now, I'm sitting in a building where we're training 22 new community health workers in violence prevention, and our county is paying for it. Why? Because we realize the importance of building a network. It doesn't matter if you're on the preventative side or the intervention side, we have to get better at working together, because we're asking a lot from our communities to change. We as organizations and state systems have to be willing to change as well to be able to change the culture of what we're seeing in our communities. Because if we're not willing to do that, then our young people are not going to listen to us when we see that this organization can't work with this organization. So that is the main thing that I have seen since I've been in this role, is the unwillingness for people to work together. We have some momentum right now. We started a multi-sectorial stakeholder coalition. We have a lot of system partners, community partners, law enforcement. Everyone is sitting at the table, and now we're starting to make some headway. So I felt that it was important for us as a county to go back in and get community members that have a desire to do this work, maybe not the funding to be able to pay for a community health worker training. And like I said, we have 22 people in the building. So one best practice I just want to give everybody freely is we have to get better with working with one another, and that's within our own cities, and that's across the state. We have a lot of youth lives that are at stake if we're not willing to work together, and we can actually do something about it in this board. So I just wanted to add that.
Thanks so much, Will. Thank you.
Thank you, Will. Very great point. All right, so let's move forward to the Youth Violence Prevention Subcommittee, because I know Nicole hung back a little bit, but she'll have to run soon. So Nicole, I'll pass it to you to give updates for that subcommittee.
Good morning. Yeah, I do have to run, but this conversation is so amazing. I'm hearing so much good stuff. I'm down here in Edenton, North Carolina. We don't have a lot of resources. My organization currently is trying to work with the town and with law enforcement, because I like what you just said, Will. If we're not working together, we can't expect the youth to work together. And currently I'm hitting a lot of brick walls. So I like that you're getting some momentum in your area and that you're getting some positive outcomes. I wanted to add to the way to get the word out, QR codes. I noticed that with this generation, they like QR codes because they can just scan it with their phone and they see something. I've used that to go to YouTube videos, to go to web pages, things that can help young people, things that they like, colorful music, all that stuff. But a QR code, you can put it on a t-shirt, you can put it on a flyer, and it just works better for them because they like technology. Our subcommittee is responsible or is tasked to bridge the gap or to identify evidence-based interventions that are used in communities. Right now, we're just gathering information about what is already available, what towns and cities are already using in the state. I'm really enjoying this because I'm seeing what the bigger cities are doing. And while I know that a lot of what you guys are doing won't work in our smaller towns, it's good that I'm able to kind of break it down, and maybe some of these things I can bring back to my team. We've heard a lot about prevention and intervention. I think that those things have to work simultaneously because the people that we serve are in different places. Some people may be ready for intervention while some people, don't want these things to happen. So prevention may sound good to them. What I notice when we're working with people, because they're all in different places, you got to kind of meet them where they are, or you'll completely turn them off. So I think when we're talking about what types of services or what types of programs we're going to offer, we have to make sure that we're meeting all the people who are being impacted by violence where they are. So let's see. Yeah, that's about all I have to share today.
Nicole, do you mind if I add just a few things?
Absolutely, Becca.
I've greatly enjoyed getting to know Nicole and Liz, and I'm really excited to keep working with them. We definitely, our group, we echoed some of the other subcommittees about the need for data, and we're really excited about Scott and Michelle. Definitely kind of looking forward to linking in with them. But kind of when we talk about the prevention, we narrowed it down to the two-arm approaches. So on the one hand, we know we need to prevent access of guns for kids and adolescents. And we have that wonderful NC Safe program. And so that will increasing safe storage is great, but we also need to focus on after school programs and summer camps, et cetera, that a lot of the other subcommittees mentioned. So access to guns will definitely be important. But then also looking at how the need does change by geography. So we're kind of trying to narrow down this information by location because the recommendations will be very different, as we've said. My outreach recently has been in the rural areas. So I've done a lot of work in Wilkes, and this weekend I was in Davie County. And so definitely we're seeing a lot of need in those areas, and the interventions and the recommendations are going to be very different. So I think geography is going to be important. And then the last thing that we'll say again that everyone else has been mentioning is this cannot be separated from social drivers of health. And so looking at the importance of safety, but also looking at the whole picture of the family unit and the community unit, you know, housing insecurity, transportation, food insecurity, all of these things work together, and safety is one item of that. And so I think keeping a family and a community safe is great, but we want to see the community thrive. And so what we had mentioned is what does a thriving community look like? And it will be safe, but there's all these other components as well. So we're hoping to look at all of this information together. Yeah, so I'm really looking forward to it. Thank you, guys.
No, thank you both so much. Two things I wanted to put on your radar immediately. And one is part of my wrap up, but specifically for rural environment. There's a DOJ grant specifically for rural and reduction. So make sure, email us about it. We'll send it out to everybody so that everybody know that it's there. But it's specifically for law enforcement organizations, I think with under 150 officers, but you'll see it in the description around how to develop a strategy and a plan, and then CVI grant, but specifically for rural environment. And the TTA provider for that, LISC, who I work with really closely. They're also the largest community development financial institution that we have in the United States. So when we talk about looking at it more holistically, not just from what we traditionally think of for violence prevention and intervention, but social determinants of health and the intersection between that and victimization and high risk for gun violence and re-entry difficulties. It's hard enough when you're getting released from incarceration or detention normally to a middle class environment. It's possible to have a successful transition when you have hundreds of bullets flying and a lot of other violence occurring in housing projects. And so we have to do, but there's some strategic work being done around housing and economic development. We want to make sure that that's tied into our of it.
Sorry, Gerard, can you repeat that? It broke up.
I'm sorry. I'm happy that this conversation is starting to merge social and economic development, social determinants of health with violence prevention and intervention. There are some great things happening in the state around economic development and housing and those things. We want to make sure that they're tied in together with the great work that this committee is doing in reentry efforts, both at DAC and juvenile justice, both for employment opportunities and training opportunities, but also in helping us to be a voice to those entities to think about what it looks like when you do housing redevelopment or community revitalization, and that sometimes may and displacement that increases some of our crime risk. But they're not hearing a lot from us yet, but they will be now. So this is a great conversation to have. That grant from the DOJ, we're going to send out afterwards. I'm pleading, I want to say begging, I'm pleading, if you're in a rural community that's having this problem, to apply. Also, Nicole, I think you mentioned, which county are you in? Is it Chowan County?
I think Nicole had to hop.
Yes, I'm pretty sure they're in a healthy opportunities area. So,
And it should be a healthy opportunity area.
Yep. So we want to make sure we work with them on that. But okay. Ciara.
Yeah, thank you. And Becca, I just wanted to circle back to see if there were any specific questions that y'all wanted to pose to the group at this time, your subcommittee.
I think our specific questions were data related, and so we are in the gathering phase. And then I think our next step would be to set up another meeting with the data sharing group. But I would love to hear any thoughts if anyone had questions for us. I'll circle back with Nicole.
Sounds good. Any questions for the Youth Violence Prevention Subcommittee? Okay. All right. Well, thank y'all so much. We've heard from all the subcommittees, so we're going to move forward in the agenda. So next is new business. And so we just want to be able to give an opportunity to open it up to all of the advisory board for anybody to share any just general updates, announcements, upcoming events, or if there's any general questions that you all have for our office. And maybe if we could use the raise hand feature just to keep it organized, if there's any questions. Okay. Oh, Sheriff Burkhead.
Yeah, good morning, everyone. I don't have a specific question, but I was listening to Dr. Tate. I apologize. I thought I didn't want to jump in when you asked that specific question about law enforcement. However, what has been said, and I think Tracy really hit the nail on the head, that law enforcement has to be part of the conversation. We have to be in the discussions about prevention because we see these individuals day in and day out. And so I'm really excited about the work that's being done in Mecklenburg and other parts of the state as well. But if law enforcement is excluded, then that will continue to be a barrier. And there's no way we can move forward in a productive manner if law enforcement is seen as part of the problem versus part of the solution. So excited about the conversation moving in that direction, that it really is going to take all of us. Good to see you, Nicole. Need to touch base with you soon, but I really wanted to say that. And I know my law enforcement colleagues, particularly members of the North Carolina Sheriff's Association, the largest urban centers, we talk about this every single time we're together. Mecklenburg County, Forsyth County, Guilford County, Durham County, Wake County, because we're seeing the violence in our communities and we need help and we want to be part of the solution. Thank you.
Sheriff, thank you so much. And I will say, because this is my last meeting that I'm gonna be here, and I don't want to leave anything left unsaid that I think could be helpful. Um, I typically don't have a problem convincing law enforcement to referrals to social service agencies or violence interrupters or CVI agencies. Sometimes I have to get in a little bit of a tussle and a back and forth verbally, uh, only because the trust isn't there yet. The gap, and we talked about it, the biggest gap that I see is once they make those referrals, who is it going to? Who's following up with it? And are those services ready to be delivered in a culturally competent way, in a wraparound intensity that we need, where Sheriff Burkhead, his team, and other law enforcement is not going right back to those calls 3 or 4 times? Because when they do, they're going to lose faith in making those referrals. And so we can get the referrals. They will, we probably even get them bring them to you as a diversion instead of going to jail in certain cases. But we don't have those entities ready yet. And that's part of what I'm really hoping that professionalization, training, certification, data sharing, funding strategies can really do. Our short staff, and they're running call to call to call. The referrals there, but we need to get the other piece in place. That I'm going to end on that. Even after I leave from this is part of what my life's mission and goal is going to be trying to do. Referrals. We need to help our communities to build the capacity to be able to serve this. And this is something Eddie said from DOJ. These grants specifically, and this straight from the DOJ Senior Advisors for CVI, these DOJ grants are specifically for the highest risk individuals, the ones that law enforcement is most likely to come in contact with, the ones that are most likely to be the victims or perpetrators of particularly gun violence and other violent crimes. Why do I say that? There are certain programs that we go to that I think there may be moderate risk, young people and young adults there, but maybe not a representation that's needed of the highest risk individuals that is hardest to reach. And so again, this is straight from DOJ, though I would say it myself. Even if you have to serve a smaller number of people, but they are the highest risk, I think we will have better outcomes. I'm gonna say it more clearly. If you only help 30 people a year, but it's 30 people that are the actual shooters and those that are getting shot, I prefer you do that than 150 of people who may be low and moderate risk. And so I wanted to make sure I get that off my. If you say you served 1,000 people a year, you didn't serve 1,000 shooters a year, because I know you don't have the capacity to do that, because all of us on this call may not have that capacity. So let us really, one thing I know law enforcement will know, the community will know too when we get that trust, but law enforcement for sure, because typically if they're that high risk, they're already either currently under investigation, been arrested multiple times, or unfortunately shot multiple times. And not all of us on this call, and most of us on this call, can reach them, right? And so many of them are reached by JJ and by county jails and state prisons. And oftentimes we can get them to do well while they're in custody. It's that reentry piece, being released back into a very unstable environment, that is causing much of the issues and problems. So smaller number, more intensive services, ensuring that it's the highest risk people is what we're really looking for. The grants are available and out there, but that is what it's intended to serve. And Ciara, I'm going to step a little bit off my soapbox now, but please, smaller number, more intensive services, ensuring that it is the highest risk people that you are serving.
Thanks,
Dr.
Gerard.
Tate, I was trying to find a way to snap my fingers, like you said earlier, because you're spot on. So thank you so much for sharing that. We are losing these young people every day in Durham, and we know who they are. And when it happens, we're like, we knew it was going to happen. Again, that's that connection that we need so we can reach those individuals. But thank you so much.
Yeah.
Are there any other updates, announcements, questions, or any just follow-up thoughts from any part of this discussion anyone wants to share right now before we move forward to the wrap up? Okay. Hearing none, we'll keep going. So I'm just gonna share kind of like some next steps that we identified, and then Gerard, I'll give you a chance to also add anything to that. But as far as next steps from this meeting today, um, we're going to be connecting all of the subcommittee chairs with your state liaison within this next upcoming week. So we'll do a formal introduction via email so that y'all can be in contact and move forward with collaborating together. And then subcommittees should continue to meet and work together towards your recommendations. And we just wanted to clarify the due date because there was a little typo on the document you all received. So the recommendations, we would like those to be done by June 28th. So if you can have those sent to our office by June 28th. Our next full advisory board meeting is on June 25th, so Tuesday, June 25th. Same time, 8:30 to 10. So that'll be our last chance to touch base as a full group before those recommendations will be due that Friday of that same week. And so we'll also follow up in email with updated info documents for your subcommittees that have that updated date, just so everything's clear. But June 28th is when we're looking for those recommendations. And as Gerard mentioned earlier, these recommendations are going to help inform a strategic plan that our office is going to be putting together. And so just a little context about why getting those around that time is going to be really helpful. And also in today's conversation, there were a lot of talks about following up and connecting people with other people. And I've been trying to take note of that through this conversation. So I have intentions to help follow through on that. But if during this conversation, Gerard said that we will connect you with somebody and you don't hear from me within about a week, please do follow up so I can make sure that I help, follow through on all of those asks. And last update before I pass it to you, Gerard, is that I just wanted to give a reminder. I know previously y'all have gotten information about how you can utilize this WebEx space for our advisory board to store information and communicate with each other. And you all should have got access to that space. It works essentially like Teams. If y'all are familiar with Teams, we have a group in WebEx for this advisory board. And so if you haven't been able to get into that space yet or have any questions about how to use it, please reach out to us and we'll make sure that we help you get into that. But again, there's folders in there for all the subcommittees where you can store information, but then also chat spaces where you all can connect with the other people in the advisory board, even outside of your subcommittees. So we definitely want to make sure you remember that you have that resource and you're welcome to utilize it as you see fit. So with that, Gerard, I'll pass it to you to see if there's any additional next steps or info you'd like to share.
Nope, I spoke a lot already. It's been a pleasure working with all of you. Many of you I will continue with slightly different capacity, but there are grants that are out now for CVI and to develop these plans and strategies. We may not all get them, but it is my hope if we don't get anything that we all are at least going to apply. We're not sure the future of CVI money, but we know right now that it's a lot of funds that are out there right now, both from a planning standpoint, CVIP. Now, everybody may not have the capacity, but I think with everybody that's on this call and an advisory board, if you're from a small rural place and you may not have partners, you have partners on the advisory board, or we may be able to connect you with research partners and others that can help you and make applications for the grant. Let us at least try while the funding is out there. to start developing, even if you just apply for a strategy one, right? The rule one is around working with a subject matter expert, researcher to develop what your strategy will be. Part of it can be used for technology and data and some of the dashboard things that we're talking about. But at least put in an application, please, if you have the capacity to do it. And work with your subcommittee even in discussing almost every subcommittee has at least one person on it whose entity either has a grant to right now or have won some of those awards previously that can help you and even provide some direction in how to write it and those things. So utilize this advisory board as a team, not just as this meeting, to be able to help and lean on. And so I will end it there. The funding is available. Please apply. We all need it. Sure how long it's going to last, but we know you apply now and get it, you at least have it for 3 years. So that's all I have, CR.
All right, thank you. And with that, that concludes our meeting. So thank you all for coming today and being so engaged. And we're here if you need us. And otherwise, we will see you all on June 25th. Bye.